Hi, everyone. For those coming in, we're just going to be waiting a few more minutes until a few more folks join. We'll probably get started in about 4 or 5 minutes. Thank you for joining us tonight. And if you don't mind, if you could make sure you're muted as we start this evening, that would be greatly appreciated. Thank you.
Hi, Eva. Welcome.
Hello, everyone.
Hello.
Hi, everyone. Welcome. Thank you for joining us tonight for our Do No Harm series. A few more folks trickle in the next few minutes. That'll be okay. The more, the better. Thanks for joining us this evening. We know that family and work takes up a lot of time, so sparing a few hours for such an important cause is really amazing. I'm going to toss it over to Leisha to get us started.
Thank you, Mona. Thank you, everybody, for joining us tonight. I was wondering if I could ask one of the pastors to start us off with a prayer in these very difficult times with so many people struggling with addiction and recovery during the pandemic and being so isolated. If you could just kind of help us set the tone for tonight, that would be great. And do I have any takers?
I can do it.
Thank you, Pastor.
Okay. Gracious Father, in the name of Jesus Christ, we come before you to thank you and to praise you for the strong interest that we have in helping souls that fall through the cracks and find themselves in a position that some would just overlook them and not take their crisis serious. And I thank you for this because it's sort of a new experience for me. It's enlightening. And I pray and trust that other faith believers, clergy, ministers will be exposed to this reality that these wonderful people are sharing with us. And I just pray that we might have your grace and your mercy and your divine direction, that we'll be in the right places to make a positive impact upon those that are hurting. I want to thank you for defeating the stigmas. And I realize that's probably going to be an ongoing endeavor. But I just ask for the leading of your Holy Spirit and bless every participant. If we work together, we can certainly make a difference. So do bless now whatever's on the agenda. May it be approved by thee. We're asking in your precious name, in Jesus' name, amen. Amen.
Amen.
Amen.
Thank you, Pastor. Thank you so much.
Thank you,
Thank you.
Pastor.
Yes, well, I think that sets a beautiful tone for tonight. As Mona said, my name is Leisha Farias, and I have the pleasure of working with the Vincentian Ohio Action Network and the Think Tanks on Poverty to bring you this webinar series. Others that are working on this project include Wendy Tarr, who is the Executive Director of VONE, Stephanie Van Bibber, who works for Whole Living Recovery and is in recovery, Misty Hunt, who works full-time to bridge the gap between faith communities and those impacted by addiction, and Mona Abhari, who is a grassroots and youth organizer in Columbus and Newark. Today's webinar will be focused on medically assisted treatment like naloxone and hearing from experts who help distribute life-saving medication in their communities. Last time, we engaged with faith leaders and community members in Central and Southeast Ohio to provide resources and tools to assist persons and their loved ones struggling with addiction and opiate use disorders. Barriers of fear, ignorance, and stigma are broken down when people take the risk to break the silence and speak out by sharing their struggles of living with addiction or by sharing the struggles of loving and caring for a family member. From there, we can start to talk about real solutions, and that's what we will continue to do today. Thank you.
Awesome. Thanks, Leisha. I'm going to toss it over to Misty to help us review what we covered in the last few webinars.
Thank you, Mona. Thank you, Leisha. Welcome, everyone. Last time we talked about, we had our webinar, we talked about practical ways faith communities can support those impacted by addiction. We dove into education around medically assisted treatment, or MAT, and addressed common stigmas and misconceptions around MAT. MAT is the use of medication in combination with counseling, behavioral therapies, which is effective in the treatment of opiate use disorders, OUD, and can help sustain recovery. We heard from amazing faith leaders already doing the life-saving work in their communities. We also all committed to being caring congregations We encourage everyone to check out the mental health ministries who form the Caring Congregation 5 Steps. Let's review what Caring Congregation is. There are many ways that congregations can begin or expand a ministry to and with persons and their families impacted by addiction. While the journey to become a caring congregation can be described in many ways, in many different ways, this Caring Congregations model uses a 5-step approach. These 5 steps include education, covenant or commitment, welcome, support, and advocacy. Education is learning about what addiction is, what it looks like, and how it impacts communities is the first step in bringing change. Commitment or covenant. We all must be committed in doing no harm in our communities if we want to help those impacted by addiction. We may not know what it looks like, but that is why we are here to learn how we can collectively do no harm. Welcome. A caring congregation will welcome those impacted by addiction into our communities and will seek intentional ways to integrate them into our faith communities. Support. After welcoming and integrating those impacted by addiction into our faith communities, we must work towards practical ways of supporting them. This can look like providing counseling, providing medically assisted treatment or MAT, training, supporting family members, etc. Advocacy. Once we have worked to educate ourselves on addiction, committed to do no harm, and intentionally welcoming those impacted by addiction into our communities, a natural step is to be involved in advocating for change that helps those in need. Now that we've reviewed a bit, let's start to hear how impactful medically assisted treatment can be. I'm going to toss it over to Stephanie for her to share her story. Thank you.
Thank you, Misty. I appreciate it. So my name is Stephanie, and I just wanted to share a little bit about my experience when I was in active use. Now I have been in recovery for 2 years. This is just my experience, and that's all I can share with you is my story. As far as Narcan, I was trying to decide, which story would be the best one or most effective to tell when it came to Narcan. So this is kind of what I came up with. I have been Narcaned one time. Someone had it, thank God, because usually that's the last thing anybody wants to do is call 911. That's a common issue that people who are overdosing don't really want to call 911 for help. But here's the interesting thing about my story is that I've overdosed, several times. I've had people that were with me overdose several times. And because we didn't have access to Narcan, what we would do would be to intravenously inject people with methamphetamine to get their heart going or get their breathing going. Never mind that could have stopped their heart, or killed them. I have, overdosed from fentanyl, and someone injected me with methamphetamine. So, and again, this was 2 years ago. At that time, I was unaware of Project Dawn or Narcan just really wasn't that accessible here in Licking County at the time. So that's really what we were left with was injecting people with meth. So, and I also remember, I just want to add this into my story. I also remember when I did overdose and they injected me with meth. I know that there was talk because nobody wanted to call the police that they were talking about just, if I did die, just throwing me out behind this apartment complex. So that's kind of the environment that comes along, with drug use and overdose and people being scared to, call for help. And my story with MAT, which is the medically assisted treatment, I'm a big MAT supporter. I was before I was given the opportunity to speak in this project. So what I try to explain to people about Matt, I was on Suboxone, which is an opiate replacement therapy. And how I looked at it was, a lot of people will talk about it being a crutch or being you're just trading one in for another. But how I looked at it was I was more successful in treatment. I wasn't going to overdose on Suboxone. I was more apt to be a productive member of society, get a job. I was very fortunate that the physician that put me on Suboxone, I did a very short taper. So then I had minimal withdrawals and minimal discomfort. But it gave me that support. It gave me like that kind of that hand up or um, that safety net until I could get stronger myself. And then again, like I said, it helped get me in, to counseling, and it was much safer than injecting street heroin or street fentanyl or, because you cut that out, um, you cut using dirty needles, fentanyl, like all that goes away. The chances of getting hepatitis, the chances of getting HIV, all those things really decreased for me once I stopped using, street drugs and started using Suboxone. And the way I took Suboxone, and again, this was, 2 years ago or more, is it was a film that I took once a day, and it went under my tongue and it dissolved. It was a prescription that I got from my doctor. And kind of like the science behind that, the way they explained it to me was it would bind to the receptors in my brain. So that if I did go and shoot up heroin, that heroin wouldn't be able to bind to those receptors. So it was a blocker. And I believe it's buprenorphine is in there too. So it's kind of a science that goes along with it. But like I said, it was a prescription that I got from my doctor that I picked up from a Kroger pharmacy. And there were guidelines with it. Counseling came along with it. Groups came along with it. But it really was, a turning point. It really gave me hope from, going from being so hopeless on the streets, criminal activity to get the drugs, stealing to get the drugs, breaking the law to get the drugs. All that went away when I entered into a MAP program, because I didn't have to live like that anymore. So then I could start working on what my underlying issues were to begin with. Childhood trauma, early trauma, just the trauma from seeing people overdose. I mean, that in itself, is trauma. These people were my friends, and I've lost several friends to this disease. And it's still very, it's a very traumatic thing. So then I would just use to cover up more of that trauma that I just kept putting myself in. So, and as far as, women who are pregnant, they're more apt to go to doctor's appointments when they're on medically assisted treatment. And again, they're not injecting street drugs. Their risk of HIV and the hepatitis goes down, and all the infections that you could possibly get from using unclean needles. So like I said, I've been a very big supporter of Matt, and obviously Narcan through this whole journey. So it's really a privilege to be able to speak to everybody about this tonight. So thank you very much.
Mona, we can't hear you. Can you come on?
Can you hear me now?
Yes, we can hear you now, but we lost your
Yes.
slide.
Sorry, everyone. This is not going to be a tech smooth night, obviously. But I just was thanking Stephanie for that really powerful story. Hers and so many others just show us why we need to continue the fight against addiction, and how medically assisted treatment is such an essential part to recovery and helping those and meeting them where they're at. So thank you again, Stephanie. That was really powerful. Now we're going to hear from Mary Loesch with Harm Reduction Ohio and all the amazing work that she does. So Mary, I'm going to toss it over to you.
Thanks, Mona. It might be best too if you just go ahead and stop screen sharing so I'm full screen, just because I'm going to show some ways to use the Narcan. So it's probably better if I'm full screen if we can do that.
Yeah, I think it's working.
Thank you. So my name is Mary Loesch. I am the Outreach Coordinator and Naloxone Distribution Manager at Harm Reduction Ohio. Harm Reduction Ohio is a small organization. We are primarily volunteer run, and we are just over 2 years old, about 2.5. So we're a small group and we are a new program, but in that time, we have distributed over 10,000 doses of naloxone. So we're very proud of the work that we've done, and we are working every day to get Narcan and naloxone in the hands of those who will use it to reverse an overdose. So Harm Reduction Ohio, primarily right now what we provide is naloxone or Narcan. And the way that we do that is we have an online ordering system. So anyone in Ohio can go to harmreductionohio.org and order Narcan or intramuscular naloxone for completely free from our website. We will ship it directly to you. There are some questions and a training that you have to go through. It's very short, but that survey information is completely confidential. We give anonymous demographic data to ODH, Ohio Department of Health, but all names and addresses remain completely confidential. We do not share that information with anyone. We share no identifying information. So essentially, we have two arms of our program. We have the online distribution service where people can just go online and order, and we'll mail it to you. Or we have our lay distribution program. And that consists of organizations and peers, meaning people who use drugs or people who live or work in the drug using community. We set them up with a bulk shipment of 12 Narcan or 20 IM naloxone for them to distribute into their community. So what do I mean when I say Narcan and naloxone? Naloxone is the drug that is in Narcan, and it is the drug that reverses an opioid overdose. So naloxone is an opioid antagonist, meaning once all the opioid receptors in the brain are covered with an opioid, the brain triggers respiratory distress. And so breathing becomes labored, it becomes slow, or it ceases. And so what happens is when you give the naloxone, it goes in, it forces the opioids out of the receptors and then covers them, which then regains breathing function. So once the opioids out of the receptors and the naloxone is in there, your body tells you to start breathing again. And that's how the overdose is reversed. So Narcan is the name brand of the nasal aspirator that looks like this guy. Naloxone is the medicine that is in Narcan, Narcan is the name brand, kind of like how acetaminophen is in Tylenol. So what Harm Reduction Ohio has to offer right now is we have either the Narcan nasal spray, or we have our intramuscular naloxone injectable. And that comes in a little vial like this. And it comes with 2 intramuscular syringes. So if you were to order Narcan nasal spray from us, we would send you, if you were to order online, we'll send you 1 box of Narcan, which comes with 2 doses, or we will send you 2 packs of the IM intramuscular naloxone, which actually has 4 doses. There's 2 doses in each pack. Or if you wanted to be a lay distributor or an organization distributing, you would get a case of 12 Narcan or 20 IM or both. So the Narcan nasal spray is very easy to use. It was designed for children to use, and it's quite simple. This is what it looks like. This is a tester, so in the real thing, this is not yellow, but and in case of an opioid overdose, what you're going to do is, if that person is sitting up, you're going to just make sure their head is tilted back. And if they're laying down, you also want to tilt their head back. And then you insert this into the nose all the way up until your fingers touch. And then you just plunge the plunger. Once you plunge the plunger once, the medicine is administered. So don't like try to prime it or push it or anything. Once you push that, the medicine's gone. There's only 1 dose per aspirator. And if the person does not revive with that first dose, you're going to wait 2 to 3 minutes and then administer another dose. And that's the same for however your naloxone comes. So if you're doing intramuscular, you're going to give them that second dose if they don't respond within 2 or 3 minutes of the first dose. And you keep that cycle going until EMS is called, or EMS responds, or the person revives. This is what our intramuscular pack looks like. It comes in a package like this. Inside are 2 sterile intramuscular syringes in a little packet like this, and it has your 2 vials of naloxone in it. To administer that, well, first of all, we use this brown packaging here and this black packaging here because Narcan or naloxone is light sensitive. So you want to keep it in its packaging or in its box until you're ready to use it, because light will break down the potency of the medicine. So when you want to give an intramuscular injection, you're going to open your syringe, you're going to take your vial, you're going to draw up, you're going to put your syringe in and hold it upside down like this, hold the vial upside down like this, and you're going to draw up all the medicine in there. Now there are instructions in your pack. It'll say 1 milliliter. You don't really need to worry about any of that because there's only enough medicine in there for 1 dose. So you can't give them too much. That there's only enough for 1 dose. So now you have your dose. And what you're going to do is you're going to inject directly into the arm, thigh, or butt cheek. So you kind of want to think of it like where a doctor would get you for a vaccination, okay? I generally tell people to go for the thigh because it is really accessible and it's a large muscle. There's very little room for error if you are injecting into the thigh. Also, ideally, you would clean the site with a prep pad and whatever first, but in real world situations, these needles go through clothing. So if somebody is unconscious and you have intramuscular naloxone and you want to inject it, you do not need to take their pants off or their jacket off or anything like that, you can just inject it straight through their clothes. And when you inject, you're going to go straight in. You don't want to hesitate. There will be some resistance. Just push through until the needle is all the way inserted and it gets down to this blue part. And then you just administer the shot. All you need to do there, all you need to really know there is to stay calm, don't hesitate, and inject directly at a 90-degree angle. Don't go in wonky or weird or sideways. Just go straight in. So a few things to know about naloxone is that it can wear off within 30 to 90 minutes, whereas opioids have a much longer life in the body. And so what can happen is the naloxone can wear off and the opioids are still in the bloodstream, and they will go back into the opioid receptors and cause another overdose. So if you're in a situation where 911 is not going to be called, whoever has been revived has to be monitored for 3 to 4 hours and provided with more Narcan or more naloxone as needed if they fall back into an overdose. We encourage people to call 911. We also recognize that it's not always a safe option. And so I just let everyone know that if 911 is not going to be called, that person must be monitored for 3 to 4 hours and given more Narcan if they slip back into an overdose. So also a thing to know is all Narcan and naloxone has storage requirements and an expiration date. So they want it stored at room temperature, and it has a 2-year shelf life. Now the FDA has recently, they're in the process of turning that into a 3-year shelf life, and that will be retroactive. But essentially all the studies that they have done on this medicine has proven that it's very hardy. Even with extreme weather temperatures and decades after expiration, the medicine is still testing to be 90 to 110% efficacy rate. So it's staying within that 90 to 110%, even 30 plus years after expiration. So even though it has an expiration date, and even though it says like keep at room temperature, even if you had it in your car for 6 months or it's expired, you should still use it. The likelihood that it is still good is much higher than the likelihood that it is not. Also, it does no harm. Even after expiration or extreme temperatures, the medicine does not change. It does not become poisonous in any way. It only just loses its potency by a little bit. So it cannot hurt anyone. Now, this is true, period. It does no harm. It only works if that person is experiencing an opioid overdose. It doesn't do anything to anyone that does not have opioids in their body. And so we always say, even if you don't know if it's an overdose, but you think it might be, give them the Narcan. If that's not the medical thing that's happening, then it won't have any effect. It won't cause any additional harm. So our rule of thumb is give Narcan if you have it, if you suspect at all that somebody has overdosed. Sometimes it's not obvious. You know, maybe you came upon somebody in their car passed out or in a park, and it's not super clear why they're unconscious. If you have Narcan or naloxone, please administer it. If it's not an overdose, then there's no problem. But if it is, you potentially save their life by giving them the Narcan. Another thing to know about Narcan is, I don't know, I can't remember. I'm just kidding. Okay, so essentially use it, carry it, Even though it says it expires, and to keep it room temperature, the likelihood of the medicine working is still very high, so use it. And you can, I feel like I'm forgetting something. I'm sorry. Yeah, so, okay. So if you want to be a lay distributor or an organization distributor, you can contact, I think there may be a survey at the end of the webinar where you can put in that information, and then we will contact you and go over the paperwork. So there is some paperwork required from the Ohio Department of Health for the Narcan. It is completely confidential. And one is just a name and address log for in case there's a recall, and nobody sees that but me. I keep it confidentially. Nobody sees it. And then I destroy it after 3 years. And then the other is an intake form, which collects demographic information and then risk related information. So if you do want to supply Narcan into your community, you will have to be responsible for returning that paperwork to us. It's not very difficult, but it is something that you would be responsible for. And then otherwise, if you would just like to have Narcan on hand, or you know somebody that would, please order online from us at harmreductionohio.org. You'll go through a brief training and we will mail you your Narcan or naloxone. And I think that's it.
Awesome. Thank you so much, Mary. That was very, very informative, and like I understood everything you like explained. I remember when I first learned about naloxone, I was like, what is that? How do you like what's all that? There's probably so much science behind it. I have no idea, but you explained it amazing. So thank you for that. And if, she said, I think it was harmreductionohio.org for like information, right? Awesome. Harm Reduction Ohio is an amazing resource and plays such an important role in the fight against addiction. So thank you for everything you do. We know that you're swamped with trying to upkeep with the demand, but you're doing a great job. So thank you for joining us this evening and educating us all on such an important issue. Of course, I'm going to toss it over to Casey. She is from Lincoln County Health Department and provides a lot to her community as well. And I think she's got some slides for us too. So bear with us if we have some technical difficulties again. But go ahead and share your screen, Casey, and take it away.
Okay, can you all hear me okay?
Yes.
Okay, great. Can you see my screen?
Yep, all good.
Let's see here. Is it big or is it half? Is it exactly what I see, I assume?
It is half. Oh, now it's big.
Okay, great.
Here
Perfect.
we go.
There you go.
Awesome. Okay. Yep, Mary hit it on the head exactly. So she did a lot of the work for me already. She did a great job at explaining. And we actually have the same exact grant that Harm Reduction Ohio has. So again, this is the Project Dawn program. My name is Casey. Thank you all so much for having me. I'm here from the health department. Project Dawn, like Mary said, I'm just going to quickly reiterate. It's deaths avoided with naloxone. It is a community-based overdose education and naloxone distribution program. So through Project Dawn, participants do receive training on recognizing the signs and symptoms of overdose, distinguishing between different types of overdose, performing rescue breathing, calling emergency and medical services, and of course, administering that naloxone. So why should we distribute naloxone? This is, it's really important. It's plain and simple. More access to naloxone means more lives saved. It's free to clients. It would be free to your agency if you are interested in having your agency have naloxone on hand and or becoming, like Mary was saying, a distribution site. So again, distributing naloxone initiates that conversation and that communication. And of course, more individuals will have access to naloxone. So I'm here today to talk to you and your agency about becoming a distribution site. If you're interested, my contact information is on the last slide, and I'd be happy to talk more to you directly about what that would look like for specifically your agency. I just wanted to share with you our current partners. Mental Health America of Licking County. Inside that building is Genoa Pharmacy, as well as Behavioral Healthcare Partners in Shepherd Hill. Actually, all currently have our naloxone kits and are providing them to Licking County residents. Our other partners include the Main Place, Trinity Episcopal Church, the library in downtown Newark, and Licking County Alcohol Prevention Program. They actually, like I said, allow us to come distribute naloxone on their property, and our distribution partners are actually trained to distribute for us. So you can be added to this list if you're interested in, making your agency become one of those. You should see in Licking County these little green free naloxone kit cards floating around. Our goal is to get out and, share about those. I also just wanted to briefly share what's happening here in Licking County. I know there are other counties on the line, but like I said, we have finalized some of 2020's numbers in overdose fatalities. And you can see here what they look like. The 2020 data, of course, does have a stopping point there. We're not clear through 2020, but so far there has been 26 overdose fatalities. The next slide that I wanted to share is a breakdown of 2016, 17, 18, and 19. And as you can see, the fentanyl and the fentanyl analogs have such a high prevalence rate when it comes to those fatalities. I felt like this was really important to share. And again, this is only in Licking County. I would encourage you, those of you who are outside of the county, contact your local health department. They may know these numbers because it is, I think, important to note and important to talk about. That way initiatives like Project Dawn can be recognized and talked about because they are important. But as you can see, that fentanyl and fentanyl analogs do have such a huge spike, especially in 18 and 19. I can't exactly give you a number for 2020 yet, but I do know it is still pretty high currently for those overdose fatalities. So that's what Project Dawn is aiming to do, really lower these and, get naloxone out there. It's the first line of defense when it comes to these overdose fatalities. I just wanted to, again, briefly talk about what's been happening. Like Harm Reduction Ohio, we started this grant in July of 19. And since then, we've given out 774 kits, which is a little over 1,500 doses of Narcan. 894 individuals received education. We know of 73 overdose reversals, and that number is hazy at best. We do collect some of that information on that intake form that Mary was talking about. It kind of goes along with our demographics. And we know that it's, hazy at best, like I said, but in my head, it's really awesome to know that 73 people got to celebrate another birthday. They got to, celebrate 4th of July again and Christmas, and they got to maybe see their kids graduate, or maybe because of COVID, maybe virtually graduate. But 73 people got to live and see another day because of the kits that were distributed through the Project Dawn. And I think that is such a huge achievement and something to be recognized. So I, love to share that information with as many people as I can. 30 plus agencies have been trained through Project Dawn. So the next steps of what it could look like for your agency, we would put in a participation agreement. We would train your staff. We would provide you that naloxone that you would provide to your clients. And then all you would need to do is provide that paperwork. Oh, I misspelled that. It says proper paperwork to us back, the paperwork that Mary was talking about earlier. We too have an online mail to order program. It is just for Licking County residents. However, there are services all over Ohio. Clearly, Harm Reduction Ohio can mail to you anywhere. And all you would need to do is get on our website. I just wanted to show you what that looked like while I have my screen shared. When you go to our website, which is lickingcohealth.org, you would scroll down, you kind of hover over our programs. It would be under this health promotion and then the drugs and overdose prevention. Or if you're on our homepage, it's actually just conveniently at the bottom right here. So it's pretty cool. You would just say request a kit. It would take you to that short training. You would put in your county. But like I said, only Licking County residents are eligible here. But if you were to put in a different county, it would actually show you where to go to find where your county is. Whoops. So what you would do is it would take you to the Ohio Department of Health's website. I even Googled Project Dawn. Whatever way you get there will work. You would actually get to this web page. It's an ODH website, and you can actually find the list of Project Dawn sites in Ohio. So if you click here, look, Harm Reduction Ohio is actually the first one, but you can look by name of county. So if you clicked on L for Licking, you would see, maybe if it's going to load, all of the L counties and then all of the places. So on here, as you can see, like Mental Health America, Genoa Pharmacy is on here. Harm Reduction Ohio is on here again, and so are we. I'm pretty sure I saw somebody on the call from Muskingum, at least Muskingum. So as here you can see, Zanesville-Muskingum County Health Department is a Project Dawn site. From there, an individual could contact and request a kit that way. So to jump back to this, like I said, this was pretty brief. I just also wanted to share with you, I think I already did a screenshot of that. Here is my cute dog I like to share and my contact information if anyone would like to email me and see what that could mean for your agency. I would love to get to know you and your agency and see how Project Dawn could benefit you and your clients. So thanks so much for having me. I'm gonna stop sharing my screen now. And I know Stephanie, who's on this call right now, has my direct contact information. So feel free to reach out to her to get my information. She's more than welcome to share that. So I'm not sure if anyone has any questions for me.
Thank you, Casey. Yeah, we're actually going to head into like a huge question, open discussion with questions. So you and Mary can both chime in on that. But thank you so much for sharing all that. That was very, very helpful information. And I know it varies by county, but you showed us perfectly how wherever you are, you can look up what resources are around. So thank you so much for presenting all that today.
And I just
really
wanted
helpful.
to let you know, I might have to pop off a few minutes early. I do have another obligation, but feel free to email me a question. I'll stay on for another few minutes, but then I will probably have to go.
Yeah, no worries at all. Thank you for coming all together. I know there are a few questions in the chat, so we can go with those, and then if you've got to go, then that's totally fine. Steve and GACC asked one. So the first one was, for an organization to distribute, do you need a terminal distributor's license with Department of Pharmacy? Would Casey or Mary
answer that? I don't know if Mary has anything additional to add after me, but so no, in order to distribute, you would kind of quote unquote fall under our terminal distributors license. It's the Terminal Distributors of Dangerous Drugs. It's really, really long name. So TDDD is much easier to say, but nope, you would kind of fall underneath us. The quote unquote responsibility would be for us to handle. We are responsible for training you and your staff, as well as the communication there. And that's kind of what that participation agreement, just so it's formal on paper, but no, you would not need a TDDD license yourself, because you would be kind of what we call a satellite site of the Project Dawn program.
Awesome. Mary, is there anything else to add to that?
No, that's exactly right. Um, anyone who distributes for us falls under our TDGD license and has legal authority to distribute Narcan to their clients. So anyone that goes through us to become a distributor is umbrellaed in and under our license. Just as Casey said, that's absolutely right. You do not need your own license.
Awesome. Useful information to have. Thanks for asking that, Steve. Another question that was in the chat was that the nasal spray seems to be quite easy. It does. So is there an advantage to using the syringe method over the nasal spray? What's the difference? Would it, they said it would be hard for them to insert someone with a needle. So they're wondering if there's a benefit or if one or the other is a better one to use.
So it really is personal choice. One is not better than the other. I do run into people who are in active use that prefer the intramuscular. I've had a few people tell me that they feel like it works faster. There's not really any data to back that up. It may just be because you're injecting someone with something, you feel as if it's working faster. But no, they're exactly the same. If you're not comfortable with the needle or injecting someone, please order the nasal spray. And I guess actually technically the nasal spray is a higher dose than the intramuscular. They raised the dosage amount. So the nasal spray is 0.4 milligrams and the intramuscular is 0.2, I believe. So technically the nasal spray is a higher dose, but I do get people requesting the IM because they feel like it works better. But I would say the most important thing is ease of use. Certainly better for you to have the nasal if you're uncomfortable injecting someone than it is to try to do the IM and not feel good about it, you know. It's definitely whatever the person that is giving the Narcan prefers, that's what you should order.
It makes a lot of sense. There are two more questions in the chat, unless Casey, you wanted to add to that at all.
Nope, actually, the Licking County Health Department only has the nasal spray, so I actually learned something new today. We don't distribute the intramuscular, so I'm glad that she was on the call to be able to provide that information because I definitely learned something new today too.
So did I.
Can I say something, Mona?
Yeah, go for it.
I'll just speak on behalf of Muskingum County because I've been in contact with someone there pretty regularly. Same for Muskingum County. They don't have the intramuscular either, so it would just be nasal if anyone from Muskingum County utilizes our health department. Okay.
Yeah, good to know. Thanks for that. Very good question. There are a few more in the chat, and feel free to keep throwing them in there as we're talking here, and we'll make sure that we can get them all asked and answered. The next one was Steve said that he has recovery houses, and he's wondering if Harm Reduction Ohio provides free naloxone to have on hand, and what about for the outpatient SUD programs, churches, etc. And I said I think they can go to the website and just order a kit per person or per location. I could be totally wrong, but if Mary, would you like to answer that a little better than I can?
Yeah, absolutely. No, you're right. So yeah, we do provide Narcan or IM to organizations. If you want it to have on hand, I would recommend just having each staff member that would like to have some go through and order online. And and get it shipped to them, and then they'll be trained and everything like that. Now, if you want to have a supply that you can distribute to your clients, then we would do another training together where we talk more in-depthly about the paperwork requirements, and then I would ship you a case of 12 Narcan, and then you would distribute those to your clients and then return the paperwork back to me. So that's how that would work.
Is the paperwork the same as Project Dawn?
Yeah, I believe so. It's the same that is required by the Ohio Department of Health for Narcan. Our intramuscular does not have the same paperwork requirements. We keep a log for the intramuscular, but we do not ask any of the demographic information for the intramuscular.
Okay, yeah, I was just curious because I have, I think, 2 people trained in Project Dawn as far as training people.
Yeah, I just would need to meet with them to verify because, you know, when it all comes down to it, I'm responsible for the paperwork.
Yep.
So I would just need to have a quick Zoom with them and make sure we're all on the same page, and then I'd be able to set them up as a lay distributor. Yeah.
Perfect. Thank you.
Awesome. Thanks for clarifying that. Let's see. We've got a lot of good questions in the chat. So after that, Wendy has said that she's heard that some people need multiple doses. How often might you run out of a box? How often might you run out if a box only has 2 doses for nasal?
Yes, absolutely. And I'm sorry, I failed to mention that, and I meant to. That's the thing, I couldn't remember what I wanted to say. Yes, it can take multiple doses to reverse. I've heard of upwards of 8. Now, the problem there is, were that many doses actually needed, or did the medicine not have enough time to work? So we say, you know, if it doesn't work within 2 to 3 minutes, repeat, like give another dose. But in an overdose event, 2 to 3 minutes is going to feel like a lifetime, you know? And so, you know, if somebody gives somebody 5 doses in that 2 to 3 minutes and then says, yes, it took 5 doses to reverse, well, is that actually true, or did you just not wait long enough to see if it worked yet? And you know, that's fine. We're certainly not judging anyone for how they respond in an overdose emergency event. I mean, it's a high stress situation, and so it can take multiple doses, which is why there are at least 2 doses in a pack. If you think that you are going to be in a situation where you are going to experience more than 1 overdose event, then I would suggest ordering more than 1 box. So that's a really, really good question. It's just really hard to say because of like user experience, like as far as who's giving the Narcan, and what steps they're following. But yeah, it is important to know that it can take multiple doses to reverse. And so, yes, if you feel like you may need, if you're just getting a box because you just want to have it just in case, 1 box is going to be fine. If you are in active drug use or have friends or family that are in active use, I would suggest ordering more than 1 time and having at least 2 boxes on hand, or 4 of our brown bag kits.
Awesome. Thanks, Mary. There's another question that kind of relates to that, and I'll ask that first before we get to the other ones, just because we're on the the topic, but Leisha's asking, what is the frequency of the number of kits a person can order? One per month, one a week, need to wait a bit? How does that work?
Yeah, you can order as many as you want. There is no cutoff through the mail order. As far as the distributors go, like the bulk distributors, we do require that you return your paperwork back for the 12 that we give you at a time before we'll send more. And that is only because we have gotten under the water with paperwork before, and I'm really trying to make it manageable so that that doesn't happen. But essentially, you could go on you could go on the website every day and order a box if you wanted. It's going to cost me a bunch in shipping, but I'll ship it to you. I don't care. Like, I'll give you as much as you want. I just have to, with the Narcan specifically, I have to maintain the paperwork in order for our supply to be met, or in order for ODH to continue to give us our Narcan, we have to maintain the paperwork properly. And so I do have that buffer of only 12 at a time, but that doesn't mean only 12 in a month. If you are an organization and you get 12 and you pass them all out in a week and mail me back the paperwork and email me and say, I passed all my Narcan out, I will ship you more the next day. Like, so it's really just depends on how quickly you distribute it as far as a bulk distributor situation. And then as far as an individual ordering online, you can order as many times as you want. And really, if you order a bunch, we'll probably email you and ask you to become a bulk distributor, or ask you if you're interested in bulk distribution. So
Awesome. Yeah, very good question. And good to know that you can order in bulk too. Let's see. If you distribute Narcan, how many boxes can you order at, oh, I guess that we just answered that. Or how many boxes can you order at a time? We just went over that. So we'll move on to the next one. Since we are appealing to churches and faith communities, does Casey, if she's still on with us, know how Trinity Episcopal got involved as a site? I'm not sure if she's still with us. Let me see. Yeah, unfortunately, Casey hopped off. She had another commitment. I don't know if Mary would be able to answer that.
I cannot answer that. I do not know.
No worries, no worries. That's a question we can send to her, and we're going to be following up with everyone on the call with resources, and we can attach the answer to that. No, not a problem. Wendy's asking if you know if high schools keep Narcan on site. That's a good question. Has Project Dawn worked with the school systems at all, or maybe even colleges too?
That's a great question. I do not know. I don't know if Project On is in schools. I do know that we do have some bulk distributors from different colleges. We have a couple of fraternities and sororities that bulk distribute for us. But we haven't made a organized push to get into the school system as Harm Reduction Ohio. Like, our organization hasn't tried to get into the school system.
Well, that's a project that we could all tackle in in the next few years here, but that would be another thing to tap into on top of the amazing work that's already happening. Let's see. That was a good question. I think that's it. That's in the chat that I see. Yeah, it would be. Mary is saying it would be good to network with school nurses to distribute those meds. So down the line, if that's something that seems feasible, then that would be a really good idea.
Yeah, we are actually currently working with some public health nurses in jails to distribute Narcan to those at risk when they are leaving jail. And so that's really great. We haven't pushed into schools yet, but I do think that's a really good idea and something definitely worth pursuing in the future.
Totally, I agree. Anyone else have any questions for Mary? Casey again unfortunately had to step away for another commitment. But we can keep the conversation going. Mary, you're doing great at answering all of our questions. There's a lot that comes with a lot of this. I did have so Stephanie at the beginning was talking about Suboxone. Would you know anything about that as far as like how one takes it, or how does someone get it? Or I know your specialty is Narcan and naloxone, and but I was wondering if you know anything about that and could tell us a little bit more about Suboxone.
So I do know that Suboxone and other Vivitrol and other medically assisted treatment is really important. I think that you can, I feel like typically it happens from, you know, maybe being in a treatment center, or perhaps you got in trouble with the law and they are referring you to MAT as a deferment program or something. But I do think that if you were in need or interested in MAT and you wanted to talk to your doctor about that, they would then be able to get you a prescription. Now there are some regulations and hoops, and you know, we do, a part of our work is to try to change policy and stuff. And so we are working to try to lower barriers to MAT. There's a lot of stigma around using MAT. And, you know, like Stephanie was saying, you're just substituting, blah, blah, blah. But the fact of the matter is, you know, MAT saves lives. Medically assisted treatment saves lives. And it, like Stephanie says, it allows people to function and to participate in their life while they're working on their recovery. And so, yeah, I can't give you like a list of steps to take to get medically assisted treatment. But I can tell you that it is really important, and it's important that we don't stigmatize MAT. Like, you would never tell a cancer patient that their chemo is a problem, you know, or you just wouldn't tell somebody that has a medical condition that the way that they're treating it is not okay in any other situation. But for some reason, when it comes to opioid addiction and drug use, you know, the prevailing belief is it's all or nothing, and that's not real. It's not what works for people, and it doesn't work for everyone. And that's why at Harm Reduction Ohio, you know, we just try to promote safe use. Certainly recovery is beautiful and great, and treatment, and we have resources, we have those available, and we do give them out, but we're not here to tell anybody or judge anybody or demonize anybody about their choices. We just want to provide things that you can have to keep yourself safe so you don't die. You know, it's our belief that drug use should not be a death sentence. So we
Totally,
love
yeah.
that.
We do. And all the whole series the whole webinar last time was like really talking about stigma around that. And there's so much stigma around addiction, and it can be really harmful to communities. And but we have to help each other break that down. And if someone did hold that belief, it's our job to welcome them and not judge them and help educate them. And more often than not, they're willing to learn and work to also destigmatize that for others. So thank you for sharing all of that. I think Stephanie said that she could answer briefly. I know it's getting close to the end here. So Stephanie, if you want to briefly answer how you become a Narcan distributor in Lincoln County, and then the MAT questions in Lincoln County too, if you're with us.
All right, thank you, Mona. So I had inquired with Casey last year on how Whole Living Recovery could be a Narcan distribution site. So that's kind of how I know what the next steps are, but it's really fairly easy. You would just contact Casey at the health department. It's almost like a contract. It's like a 5-page contract that you would need to sign. She would either do some type of Zoom training, or she could do an in-person social distance training to train the people at that particular site on, how to get out the Narcan. And then I miss Casey's, but I know with harm reduction, it's the same way. That paperwork is huge. That's like the most important thing, because when you fill paperwork out with the expiration date on the Narcan, the lot number, where it's going, who it's going to, then that ensures that when you give out that Narcan, then you're going to get a replacement. That's just how this program works. It's huge. And I actually volunteered at the health department, putting those kits together for them. And I had to put all that paperwork in there. So it really is just as simple as that. It's getting a hold of Casey at our Licking County Health Department and getting the ball rolling that way. She's great. I'm sorry that I missed her presentation on here, but she's really great. So, and as far as medically assisted treatment goes in Licking County, I like the name of it, medically assisted treatment. It assists you. It's not a replacement. So I know with our people that live within Whole Living Recovery that are on medically assisted treatment, whether it be Suboxone or Vivitrol, we partner a lot with Shepherd Hill. That's kind of like where our contacts are. So we have them call Shepherd Hill, and they immediately get an intake appointment. Either, they'll speak with a physician there on what's best for them, because it really is a case by case basis on whether, Suboxone is a good choice for them, or the Vivitrol shot's a good choice for them, or if they're coming off Suboxone and going on Vivitrol. So we work a lot. We send a lot of referrals and stuff like that to Shepherd Hill, and especially like people coming out of treatment into one of our houses. There's Shepherd Hill, but I also know that there's Brightview is here. So that's another type clinic. But again, physicians, and again, this is really just it's a prescription like you would get for blood pressure, or you would get for diabetes, and you take it to the pharmacy and they fill your script and then you get your medicine. But always followed up with, with Shepherd Hill, they go in and follow up with, those guys once a month. They check on their treatment goals, things like that, because it's assisting the other part of their recovery. So it's not just solely, taking Suboxone or Vivitrol, it's one small piece in a big puzzle. So I hope that was helped out a little bit.
Totally did. Yeah, I think the really important thing to nail is that there's a holistic approach to so many of these issues. So talking about all of them, not even individually, but connecting the two is really important. So thanks for that helpful information, and don't apologize for stepping away. You were doing another important call too. Another webinar was going on tonight about reentry and talking about that and how it can play out in our community as well. So another example of how a lot of our issues intersect and a lot of the solutions can intersect too. So I think that is all question-wise and all of that. We're going to go ahead and wrap up. Thank you to Stephanie, Casey, Mary for all the great information and personal storytelling that you shared tonight. It's really helpful and helps ground us in our work ahead and also how far we've come in what we do in our community. So thank you so much for sharing. It was amazing. So we have one more webinar left in the series that will be next Monday, the 21st, same time. We will follow up with all the resources with this webinar. I know that a lot of information was thrown out, so we'll make sure that we can get all this out to everyone. And then please try to attend the last one. We are going to be talking about how all of this relates to COVID. And how that also is another added layer to the communities that are struggling with addiction. So thank you all for joining us this evening. Thank you for committing to becoming a caring congregation, and thank you for committing to doing no harm. Together, we're stronger, and we're working together to help those that are really in need. And supporting them as well as leaders in our community. So thank you again. To wrap up, I don't know if anyone else on the team wants to say anything before we say goodnight.
I just wanted to say thank you, everyone. Thanks for everyone for coming. Thank you for your stories. Thank you for all your input. Thank you for your information with Harm Reduction Ohio. I learned a lot from that. I appreciate it. Thank you so much.
I want to also say that we are going to be sharing, we're going to be sharing this webinar with some folks. We have a lot of people that have expressed interest, but you can't always get everybody live at every single Zoom. So we're going to be following up with different faith leaders and different community members who have been in touch with us about this series and expressed interest in possibly becoming distributors. So we're just grateful we were able to record this webinar, and so we'll continue to get it traction in order to continue to expand access in our community. So I think this was a very, very useful time with you all, and we're grateful for your expertise.
Thank you guys so much for having me. I really appreciate it. And please order Narcan online from us and contact me if you'd like to be a distributor. Thank you so much.
Thank you, everyone. Have a wonderful evening. Stay safe, and we'll see you next Monday.
All right. Good night, everybody.